Good morning, friends, to everyone. In the last presentation, we discussed about sodium nitrite, which is a powerful antidote for cyanide poisoning. Today, let us discuss with another inorganic compound, sodium thiosulphate, which is used in combination with sodium nitrite for the treatment of cyanide poisoning. Sodium thiosulphate is an inorganic compound with the molecular formula Na2S2O3. Here, its molecular weight is found to be around 284. Sodium thiosulphate can be prepared by treating sodium carbonate with sulfur dioxide and water with followed by sulfur. Soda ash, as it is called, for the chemical sodium carbonate is dissolved in water, and to this sodium carbonate solution which is prepared, sulfur dioxide gas is passed into it. When you pass sulfur dioxide gas into sodium carbonate solution, reaction takes place to give rise to sodium bisulfite or sodium hydrogen sulfite with the liberation of carbon dioxide. The liberated sodium bisulfite is again treated with soda ash, and the hydrogen in sodium bisulfite is replaced by sodium to give rise to sodium sulfite Na2SO3. The sodium sulfite is again treated with sulfur. This gets added up to give rise to Na2S2O3, that is sodium thiosulphate. Sodium thiosulphate is an inorganic compound which is white granular crystals in nature. They are freely soluble in water like other inorganic compounds like sodium nitrite, sodium chloride, and so on and so forth. Chemically, it is a reducing agent. Here, sodium thiosulphate, it is used not only for cyanide poisoning, it finds its use as an antifungal agent to treat the fungal infection caused by Tinea versicolor. It has another application, that is, it decreases the side effects of cisplatin. Cisplatin is an anti-cancer drug. The sodium thiosulphate, similar to that of sodium nitrite, it forms methemoglobin. The hemoglobin in the human body gets oxidized to methemoglobin, and the cyanide ions, which are bound to cytochrome oxidase, a mitochondrial enzyme, and as the cyanide in this cytochrome oxidase has high affinity to this methemoglobin, it removes the cyanide from the cytochrome oxidase and allows to function normally this mitochondrial enzyme. And the first action is similar to the mechanism followed as that of sodium nitrite. This sodium thiosulphate is always combined with sodium nitrite to give its effect. And generally, sodium nitrite is combined with sodium thiosulphate, and it is administered after sodium nitrite immediately. And this will be a very useful treatment for severe cyanide poisoning cases. And not only it forms methemoglobinemia and removes the cyanide from cytochrome oxidase, it also serves as a sulfur donor and converts the cyanide which has been absorbed into the body to non-toxic thiocyanate. Thiocyanate chemical formula is N double bond C double bond S. For this conversion, it utilizes the enzyme rhodanase, and the cyanide which is getting converted into thiocyanate is removed or excreted from the urine easily from the body. This also has two mechanisms. One is formation of methoglobinemia similar to that of sodium nitrite. Another, it can act as a sulfur donor where it converts the cyanide to thiocyanate by utilizing the enzyme rhodanase, and which will be removed in the form of urine. This is also administered intravenously followed by sodium nitrite administration. Why it is used along with sodium nitrite? Why not alone? This is because of the fact that sodium thiosulfate has slow onset of action. When we want immediate effect, it won't be effective. That's why sodium nitrate is having rapid onset of action, and hence sodium nitrate is given first and then it is followed by intravenous injection of sodium thiosulfate. As it has similar mechanism as that of sodium nitrite, along with it acts as a sulfur donor, it has synergistic effect. What is this synergistic effect? Means when I use sodium thiosulfate and sodium nitrite together, the therapeutic effect which gives will be more than that when it is used individually. Sodium thiosulfate can be used along with sodium nitrite in cyanide poisoning, and it finds its use when cyanide poisoning and carbon monoxide poisoning occurs simultaneously, or also it can be used in carbon monoxide poisoning. The cisplatin, which is used as a chemotherapeutic agent for the treatment of cancer, it causes ototoxicity. Ototoxicity is loss of hearing. This occurs as a side effect or adverse effect when cisplatin is given to cancer patients, which includes both infants, children, and also adolescents. That's why to reduce ototoxicity, sodium thiosulfate can be used. This is used as a prophylactic in the treatment of ringworm infestation in the form of foot baths of sodium thiosulfate. Sodium thiosulfate we prepare in water, the sodium thiosulfate solution, and this is used as foot bath. When we use this, it acts as a prophylactic agent, and it do not cause ringworm infections. It also finds its use as an antifungal agent topically. It can be used in the form of ointment along with salicylic acid to prevent the fungal infection of the skin caused by Tinea versicolor. The side effects of the sodium thiosulfate includes vomiting, severe joint pains, mood changes, psychosis, and also ringing in the ear. As sodium thiosulfate is toxic, another alternate for sodium thiosulfate for cyanide poisoning is recommended, that is hydroxocobalamine. Hydroxocobalamine is a another form of vitamin B12. This modified form of vitamin B12, that is hydroxocobalamine, is used as a preferred antidote for cyanide poisoning in many of the cases. And as it is having lower toxicity and is very safe to use in smoke inhalation victims. When the victims inhale the cyanide in the form of smoke, hydroxocobalamine can be used as an antidote. In the next class, we can deal with another antidote. Till then, have a nice day. Thank you.